Hi Rose, this is a left foot model. I don't have a right one. Oops, it's a right one, I don't have a left one. It didn't sound right. Okay, so here's the fibula, so it's the right side, okay? So here's the navicular. And it is connecting with the head of the talus, which is the talus is very convex up and down and side to side, and it matches that. A little bit more of a planar joints in the front where it connects to the three cuneiforms. It actually, contacts all three of them. So it sounds like maybe the navicular got stuck in supination, okay? I could be wrong, but a hands-on test would determine that. So the treatment for it would be to walk down the front of your tibia, okay? And that puts your finger on the talus, okay? Another finger width, you're on the navicular. So by grabbing your foot and pulling it forward for 30 seconds to take up all of the slack, and then drive it inferiorly. So the first one, I pull it towards my nose. I'm sitting, facing this table. So the first one is you traction the midfoot, and then you drive it inferiorly. So I'm sitting here, sitting on a stool, it would be towards my belly. I do that for 30 seconds. I keep both of those forces, they're stacked movements, and the third one is rotation into pronation, and then I would oscillate it 30 times, okay? So if you have a supinated navicular, that's the treatment. Now you could have a bony growth there, an exostosis, and it might be rubbing and causing pain. So if the treatment I show you doesn't work, then the next treatment would be to get an x-ray and see a foot specialist or an orthopedic doctor, okay? There's the slightest chance that your cuboid could be also stuck and causing that. The treatment is the same. You come behind the fifth ray and you just pinch, and you drag it forward for 30 seconds to maximally take up the slack, and then you glide it up and down 30 times, okay? And the last thing I would want you to do is you grab the heel and you traction it inferiorly very gently, because the heel only weighs 10 ounces or so, and you just want to distract the heel off of the talus, the first joint. And you do that traction for 30 seconds, it's magical. It will restore abduction, adduction, and inversion, eversion. So that's the last thing I would add. If I ever head your way, I'll let you know, and I hope that's helpful to you. Can you keep me in the loop? And I'm so sorry. I had a profound headache for 2 weeks, and I finally figured it out yesterday and treated 4 ribs. So sorry about that.